Hi, I'm Dr. Ashwin Malia, a senior consultant urologist and robotic uro-oncosurgeon at Sir Gangaram Hospital, Delhi. So robotic surgery is very widespread now. So I think just in India now we have more than 125 robotic systems installed all over across various states. So I practice at Sir Gangaram Hospital, which is a tertiary care 900 bedded hospital in central Delhi, where we have the experience of operating on several robotic platforms. We used to have the Da Vinci SI robotic system. Following now we have the Hugo system by Medtronic, which is a state-of-the-art system, and we've already completed close to 500 surgeries in our institute with the present robot, and we have completed more than 2,500 surgeries with the previous robotic system. So we have very good experience of usage of various robotic systems, and I think the outcomes that we have been able to provide to the people of Delhi and surrounding states and across the world, it has immensely benefited the patients. So whenever you have been advised surgery by your surgeon, it is important to have a clear conversation as to what are your expectations and what kind of outcomes you are looking for, because there might be different expectations based on different age groups of the patient. So have a clear conversation. See if your surgeon is able to give you time to answer all these queries. It is very important that the surgeon is able to allay all your anxieties and fears prior to the surgery and give a realistic viewpoint as to what to expect following the surgery. Rest, I think most surgeons who are practicing in reputed hospitals are skilled enough to do the surgery. So I think the comfort level that the person enjoys with the surgeon and how he has taken them through the process of diagnosis and how he has communicated, and of course experience in that center, whether that center has good backup of for example say cardiac sciences, people have a good anesthetic team, a prolonged track record of dealing with complex patients. So please look for a center like that, and I think you'll be doing well. Generally, I think if you're going in for robotic surgery, selecting a urologist or neurosurgeon who has gone through a fellowship in robotic surgery or uro-oncology will be of benefit, because they know exactly and they have a lot of experience in being mentored by experienced robotic surgeons. So having said that, a lot of surgeons have been doing this even without fellowships from long time, so they have gained experience over time. But currently there are several good fellowships available. So if your robotic surgeon has a fellowship certificate from a reputed organization, that would be the correct way to select your surgeon. So it's an often neglected aspect of treatment that the family who is along with the patient, accompanying the patient, going through all the pain, most of the pains of the patient is neglected. We don't talk about their role. So I think a supportive family or supportive partner, a supportive spouse, whether the patient is male or female depending on that, it's always very important having a supportive partner through your care process, whether it's diagnostics, whether it is the treatment per se, whether it's the follow-up, reminding the patient of precautions to be taken. All this go a long way, and I would just give the message to the supportive the support system of the patient that without you it's very difficult for the patient to undergo any procedure, and we should thank them, and we should ensure that they also are even their concerns are addressed, because sometimes we just ignore the questions of the attendant. So I always make sure in my practice that both the patient and the person who is caring for the patient, their questions are answered, because I think that's when I get the optimum results in the post-operative period. So I would like to talk about my process, how I go about in my practice. So what I have been told by most of my patients is, and why they like to come to me, is because of the time I give them, the answers that I give to their questions. Sometimes I may have long patient conversations. I keep a limited number of appointments every day for this very reason, that I'm able to attend to my patients very well. I think a lot of questions that the patients have come from a place of fear, come from a place of ignorance, so come for a place of concern for themselves and their family. So for me, the cornerstones of my practice are effective communication, allaying the anxieties of the patient completely, and answering most truthfully their questions. And I think these are the foundations of my practice. So after a very thorough history and very thorough examination of the patient. I go through their investigations in detail, even if it means procuring all their previous imaging and scans, loading it onto my system in the hospital, sitting with my radiologist and going through each scan carefully, because many times very critical details may be missed. If a scan has been done elsewhere, I always get it double checked in my hospital. So this gives me a very thorough evaluation of the patient. Prior to the surgery, my planning entails detailed conversations with the pathologist, with the radiologist, with the tumor board if need be, and answering the questions of my patients and their attendants. After the surgery, I make sure that I meet my patients and their families and talk to them about what has gone on during the surgery, whether there were any problems, whether we had to make some changes in our surgical plan, and show them the specimen of the organ that I have removed, and talk to them about generally how the post-operative care would be. So I think effective communication at every stage has helped me a lot, and this is and will remain my principles for the years to come.